Dear friends and esteemed colleagues, wishing you a very happy, healthy and prosperous new year. I would like to extend my invitation to all of you for SwasthyaCON 2020 being held on January 10th to 12th, 2020. During each SwasthyaCON, we have discussed unique issues that have helped all of us in improving standards of diabetes care. This year also, the scientific program is tailor-made in such a way that will help in enhancing your practice. As one of the major attractions of the SwasthyaCON this year, we have set up a very unique and engaging bootcamps workshop completely customized to your very needs of day-to-day clinical practice. Friends, you will agree with me, since the time diabetes was identified as a disorder till today, its management has undergone a constant change. Especially over last 100 years, researchers have identified a dozen or more clinical pathophysiologies as associated with type 2 diabetes. And today, at least 12 major evidence-based treatment strategies are available to manage the condition, each with its set of evidence of efficacy and safety, as well as baggage of unique challenges and side effects, often affecting the diabetes population differently due to multiple underlying comorbid conditions and other known or unknown factors. Moreover, today we also have dozens of practice guidelines, expert opinions, consensus statements, all trying to make things easy for us, but often leading to more confusion due to lack of applicability to our own patients. However, as an expert clinician with great experience of treating hundreds of type 2 diabetes patients every week and at times every day, we know that the diabetes management, when done right, need not to be too complicated and confusing, at least for a great majority of our patients. We should, however, be able to provide great attention to more deserving patients with more complicated presentations and comorbid conditions. At the SwasthyaCON Bootcamp, we will focus on precision medicine, an emerging approach for disease treatment and prevention that takes into account various individual variabilities, an approach that is expected to facilitate more accurate treatment and prevention strategies in contrast to a one-size-fits-all approach in which disease treatment and prevention strategies are developed for generalized usage. Today, precision medicine is being evaluated for many therapy areas, including oncology, neurology, nephrology, etc. And of course diabetes, the one with one of the largest disease burden. Broadly, in our day-to-day practice, we come across patients who present with less complications and treatment considerations than others who require significantly more attention and informed decision making. The sole objective of the bootcamp will be to devise in real time during the workshop a treatment strategy customized to your own routine practice and kind of patients you encounter as identified by yourself. It is possible that such approach will help you to correctly identify and manage the maximum number of patients who have fewer treatment considerations in an easy and swift manner and help you spend more time with the more complicated cases. In our next video, we will describe how the bootcamp will be conducted and what you need to do to actively participate in and benefit for the same. Stay tuned.